Hello, and welcome to Insightful Conversations with your host, 3 Principles practitioner, Adey-Jones. Join her each week as she welcomes some of the world's leading 3 Principles teachers and practitioners who share how this understanding has dramatically improved the quality of their lives and the lives of those they work with.
I'm so thrilled to be joined by my very good friend and colleague, Jacquie Forde. In addition to being a 3 Principles teacher and transformative coach, Jacquie is also a trained midwife and doula and a mother of 3 beautiful daughters, one of whom is about to become a mother herself. Jacquie is here today to talk about a very important subject that is very close to her heart, and that is how the COVID-19 pandemic is reshaping how women around the globe will navigate their pregnancy and experience the birthing process. Instead of enjoying the wonderful, awe-inspiring journey of bringing new life into the world, expectant mothers are now experiencing anxiety and panic attacks. Welcome, Jacquie. Thank you so much for being with me today.
Thank you, Dale. It's an honour, and it's lovely to see you from across the pond.
I know. I'm missing my European trips. Missing seeing you in person. But anyway, I'm so thrilled you're here today. It's such an important subject. And as I said, you're about to become a grandmother. So this is something that's right up and central to you right now. So before we start, how's your daughter doing in her pregnancy? I know she's almost due.
She is. She's got 2 weeks to go. The baby's head is engaged. It's in the pelvis. It's rubbing away on the cervix, causing all sorts of little Braxton Hicks contractions to happen at the moment. She's good. She's relaxed, and we've been speaking every day, and we can talk about some of the things that I've been speaking to her about, because it's been an interesting journey, both for her and for me, because this isn't what we thought it would be: a first grandchild and her first child.
Yeah, I'm sure. I know there's so many things to consider, not just through the pregnancy and how that's been impacted, but then the birth and then the after the baby's born. And so just take us through some of it. Like, start off with the pregnancy, how women in the world right now are being impacted by the coronavirus in how they're getting their healthcare, their normal prenatal healthcare.
Yeah. If I can start, Del, by saying for hundreds of years, women have been having babies during famine, during extreme poverty, during pandemics that have happened in the past. Life has occurred, okay? Life always finds a way through.
Yeah. Oh, I love that.
The interesting thing here is, it's not so bad for women that have had children before. But there's a lot of young women or women out there who they're having their first baby, and they have a very set idea of how they thought it was going to be and how that journey was meant to be. So these visits to their healthcare provider gave them confidence and helped them understand what was actually going on in their bodies. But because of the COVID-19 pandemic that's happening at the moment, obviously, a lot of hospitals are limiting that touch point. They're limiting the point at which the women come in, and they're limiting the people that can come with them. So a lot of fathers are not getting to see the scans if the scans happen. A lot of fathers-to-be are not even going to be allowed into the labour room in some parts of the world. So there's a lot of women that are looking at what they thought was meant to happen and seeing what might happen, and in that gap, absolutely freaking out, absolutely having a problem and panicking, having a lot of fear about what could happen in these next stages. So for Megan, and I'm sure she won't mind me using her name because I talk about her all the time.
No, I didn't use her name. I was being careful just in case.
You were doing brilliantly, and I thought, well, I'm just going to use her name. It's been interesting for her because, like you said, I used to be a midwife, okay, and I was a doula. So I thought my job during this whole pregnancy was to to teach her and to prepare her, as any mother would. Any mother would do this. But having been a midwife, I thought I had these weeks after she finished work, especially to spend time with her when she was nesting, to have time with her while she was getting organised for the baby, to cook things in the house, to put in the freezer, to do all these beautiful things that we thought we were going to get to do. But what has happened, Del, is something even more beautiful. We talk via Zoom every single day, or if not most days, and we're talking about what's happening in our body, and we've got no distractions. We're getting to talk about it, and I'm explaining to her what's happening with her contractions, what's happening to her cervix, what's happening with the baby. I've taught her how to check where the baby is and how to check what way it's facing, sort of midwife techniques, and she's just absolutely loved that. But more than anything, it's been teaching her about the power of now, this moment. Because when we first realised that this pandemic meant that we weren't going to be together and we wouldn't be able to see the baby when the baby was born, there was a lot of tears. There was a lot of suffering because, like I said earlier, this wasn't the way it was meant to be. And so speaking to Megan about it and helping her realise that this is now, this is how it is. And every time we try to make it something different, every time we try to have a possible different outcome in our mind, because in reality, there will never be another outcome. This is the outcome. The baby will be born. We won't get to see it for we don't know how long. Mm-hmm. And every time we deviate off of that, there's tears, there's upset. Mm-hmm. So teaching her about being in the moment, trusting her body, trusting her wisdom, trusting that everything will be exactly the way it's meant to be, and knowing that we're all keeping her safe and the baby safe. And that can only be a good thing.
Yeah. As you're talking, I'm thinking back to my first pregnancy and first birth, I should say. I mean, you have all these amazing best laid plans. I wanted a home birth, but I was a bit nervous. So I had it in a hospital that promised me I could have the home birth experience. There was a tub there that I could give a water birth if I want. And as life would have it, it completely and utterly went out the window. It was not anything like that. The baby got stuck. There was all these different things. But you're right. So the next time, the second birth, I was a lot more relaxed because I had let go of the image of the perfect birth and what it was going to be like, because it is ultimately completely and utterly out of control in that moment. So...
absolutely do. Absolutely.
Anyway, but especially I think in that moment. So I want to ask you, about, I know here, most of the hospitals here, I think I shared with you, a friend of mine is going to be a grandmother exactly the same time as you. The hospital that her daughter was going to give birth in have said her husband cannot be with her. And it's very important to her that she has a husband with her. So they've moved to another hospital that's about an hour away, as opposed to one that was just 20 minutes away. So I'm wondering, what's happening in Scotland or where you are? Will your daughter's husband be allowed in the room with her or not?
Yes, he will be allowed in the room, but only when she's in active labour. So when she's about 4 centimetres dilated onwards. Craig has also been self-isolating with Megan. His work has given him compassionate leave. So in the run-up to the birth, he's self-isolating the same way that she is. So they've not been in contact. They're getting deliveries of food. They've not been out apart from out for their walk. So they're in contact with absolutely no one. So the likelihood or the risk of them catching anything is very, very, very low. So Craig will be allowed to be in the delivery room with Megan, but only when she's in good going labour. So that means they have to play it quite careful in that they go to the hospital once the contractions are regular and they're strong, and so that they'll need to wait until that actually happens. And that again, Del, is this opportunity to be present, to listen to your own body, to listen to that wisdom that is within your body that tells you, yes, it's time. it's time. Megan wanted a water birth. She wanted the baby to be in the birthing pool, and she was told this morning that that's just not an option. It's too risky. From an infection perspective, and they've just said no. And you know what's been lovely, Del, is watching her ride the waves of, this is the way I wanted it, but this is the way it's going to be. You know, when she told me that this afternoon, she was like, oh, well, that's just the way it is. And it's a plan, but nothing's fixed. Nothing's fixed. And I guess this is where a lot of the women that I'm speaking to at the moment, they're petrified because what they thought was going to happen isn't, so that they feel as though they're in this space of uncertainty and the unknown. And it's gorgeous to have a conversation with people and say, well, that's the space we normally live in. Nobody knows anything.
We know that, but most of the rest of the world doesn't, unfortunately. Oh, God, as I'm listening to you, I'm thinking, what an absolute blessing that Megan has you in her life, not just because of your experience being a midwife and not just because you're her mother, but because you are a three principles practitioner too, and you can bring that beautiful space of, like you say, just, pointing in that direction of being in the now, the best laid plans. We have no control anyway, just like we said, we have zero control. And I think it's like when you're having your first baby, I think there's a lot of control in it, down to the pram you're going to buy, to the, everything. It's like you're just building that beautiful little nest and creating and bringing this new life. And I love what you said in the beginning, that nothing can stop life from coming through. There's been famines and pandemics before, and I just love that. It's a wonderful thing to sort of keep in mind during all of this. So the women that might be new to the principles and might be listening in because they're pregnant, what can you say to them right now?
Oh, I think one of the things I want to say to them, Del, is to be gentle with themselves, to be incredibly gentle, and to almost cocoon yourself in this knowing that everything is going to be okay. And you don't have to get involved in the making of a baby. The baby does that all by itself. There's this incredible intelligence behind life that tells the baby when the limbs are meant to bud, and tells the baby when, the heartbeat's meant to happen, and gets the baby all ready for delivery by giving it extra brown fat and, sort of giving it some vernix, they call it, all over its skin, so that when it's born, it can maintain its own temperature for a couple of hours. You've got nothing to do with that. And if you tune in and you listen to your body will say, rest. Your body will say, eat this. Your body will say, I have a craving.
Yeah.
So you don't have to control everything. And I think a lot of women in particular, we're so used to trying to manage and micromanage things that we don't give ourselves that grace of knowing that we can actually step back, especially now. We can step back and just allow life to flow through us, Del, because it's going to do what it's going to do, even if we try to get in the way.
Yeah. I remember I loved being pregnant. I mean, I was throwing up like most people, women, the first one. But there was something very, this animal. I felt like an animal when I was pregnant. It took over my sort of, my little brain, my thinking. It was just this beautiful feeling of connection I had. And when I had the baby too, my son Luca, it was actually his birthday today.
Oh, so, happy birthday, Luca.
27 years ago, I was doing what we're talking about. But it was this animal instinct of, when he had that vernix on him, I wouldn't let them bath him. I just held him, and I didn't want them to dress him. I was holding him by my chest, both of us wrapped in blankets. There was just such an animal instinct took over. Anything I can say.
It's primal, Dale. It's primal.
Yeah. And to trust that. Like you said.
Absolutely, to trust that. It's like, speaking to Megan, and she's saying things like, oh, like my my smell is heightened at the moment. I'm very tuned into my body. And it's interesting because even our wee dog, who's a Boston Terrier, Harris knows something's going on because he will not leave her alone. And he lies over her tummy every night. He knows something is happening. So there's, again, this intelligence that we can't explain, but we see it in action when we look for it.
It's so beautiful. And it's so important, I think, during this time when you feel that there's chaos around you, to know that space within, when you're connecting with your baby and your loved ones. I mean, even the dog, you're all one. You're all feeling each other. And you're all there for each other. So I love that.
Absolutely, Del. I mean, another thing that I would say, if there's any women listening to this who are pregnant, is remember to breathe. Your body has this incredible GPS system, this navigation system, and we all know when we're stressed and we all know when we're relaxed. So learn what it feels like to be one way and learn what it feels like to be the other way, because it's not always a conscious thing. We're not always conscious that we're stressed, but we can feel it in our bodies. And my invitation for women listening is, one of the best things that you can ever do is to breathe, and to breathe deeply, to breathe from all of the depths of your lungs, taking longer to breathe out than you took to breathe in. So breathing in through your nose to a count of 4 and breathing out through your mouth to a count of 6. That allows you to get more oxygen into your body, which in turn is good for the baby. It's also good for your brain because it sort of knocks you out of that sort of stressy space, which is just beautiful, and it calms you right down. And it's great for when you have your contractions, and what's happening with the women that I'm speaking to when I've looked after people when they've been in labour, is a lot of women, the minute they feel any kind of discomfort, any kind of pain, they contract, they pull in, they get a fright, and so they do this. And when you do that, you actually suffer more. There's more pain. And so I often say to women, what I want you to do is to think of your body, that your body's having these surges. They're not contractions. They're powerful surges that are doing exactly what they're meant to do, to prepare your body for childbirth, to push your baby down into the birth canal. Enjoy it. Enjoy the rise and the fall of these powerful surges. Breathe with them. Practice breathing, like I just said, in for 4, out for 6, and then you'll ride these contractions like, honestly, like a surfer on Malibu Beach on one of these great big waves. It's a wonderful way to be, because your sympathetic nervous system does what it does without us needing to do anything, Del.
Yeah. Yeah,
and when we're in essence, that's where we are. The sympathetic nerves is just doing what it's doing.
Yeah, I think sometimes I love that about the breath as well, because I think sometimes when we are in our anxious minds or anxious, in a thought storm of anxiety, it's you hold your breath unconsciously.
Yeah.
Just is like, and that amps up that anxiety because you're not getting that oxygen.
Mm-hmm.
So I have one more question. I don't know why it's coming up for me, but I was extremely lucky. I did not suffer from postnatal depression at all. But I know that there are some mothers out there that may be having a second child or something, and they experienced that the first time. So can you speak to that a little bit too, if they have that on their mind?
Yeah, again, Dale, when you asked me at the beginning, did I have any advice for women, and it was be gentle with yourself. Mm-hmm. Okay, having a baby is a huge toll on your body, and it's a huge toll on your state of mind as well, because you're having broken sleep, you're tired, you're maybe feeding the baby by yourself, you may have other worries. There can be all sorts of concerns. And all of these things, the tiredness, your body's immune system is depleted, you're creating milk for the baby, you're doing all of these kind of things, that can lower your state of mind. And when you recognise that as human beings, we're always living in the feeling of our thinking. So whether you're conscious of that thinking or not, Like I said earlier, your body will tell you if you're in a low mood. Your body lets you know whether you're in a happy mood. There's a different feeling. Tune into that. Psychologists and psychiatrists call this postnatal depression. I call it an invitation to rest, an invitation to sleep, an invitation to slow down. Because when we're tired or when we're overwhelmed or when we're depleted, we have a tendency to believe our thoughts more than we would when we're feeling really, really good about ourselves. And there's no difference from a woman who's just had a baby to someone who's stressed out at work. It's exactly the same thing. It works exactly the same way. You just need to breathe and take time out. Whether that's just every time your baby sleeps, go and sleep. It doesn't matter if your house is a mess. Doesn't matter if the washing needs done. Doesn't matter. What matters is that you rest and recover. They're calling this the 4th trimester now. Once you've had a baby, doesn't mean to say you're back to normal. You need to take time to give your body back what it needs. You spent the last 9 months building a placenta, building a baby, pushing a baby out. You need that time in this last trimester, the 4th trimester, to nourish the mama again. Nourish yourself physically, spiritually, psychologically, nutritionally, emotionally. Make time every day for you, for your baby, for your heart, for your soul. Eat clean, healthy food. I think as well, a lot of mums, when they've had their babies, they grab food to eat, and often that food can be junk food. Junk food's not good for our psychology. It can cause our brains to get cloudy. It can cause us to feel down and lower our consciousness. Again, my invitation is, in the 4th trimester of your pregnancy, don't worry if you feel a bit low. Don't worry if you feel a bit down. You don't have to go in and analyse what you're thinking. You don't need to look at the content of what you're thinking. All you're recognising in this moment is you're tired. You need to rest. And that will pass. That will go. Because, I mean, hey, how often have you already maybe been in a bad mood or tired or overwhelmed or judgmental on an evening, and then in the morning everything's okay again? Reset yourself back to your factory settings. Rest. Make sure you're drinking enough water. Not lots of tea, not lots of coffee. Drink lots of water, because the water will help you stay hydrated. It'll help your cells repair, and it'll keep your mind lovely and clear.
Wow. I love that. All of it. It's so important. So important. And it's so simple. It's just so simple. I think women these days have, they think they have to do it all. And I just love what you're saying, to really just listen to your body, and to just everything you said, from not taking your thoughts so seriously, to not panic. It's natural to maybe feel a little depleted and a little down, but that will pass. If you just do everything that Jacquie just explained, lots of water, lots of rest, lots of good nutrition, and lots of self-care and compassion towards yourself as your body changes too. And I love
Absolutely.
that.
Sorry, Dale, I was just going to say.
Yeah, you say.
It's so true.
Yeah. Yeah. So, well, thank you. I think that is just beautiful, and I think we should just leave it there. I think all those lovely expectant mothers out there, just be in the moment, enjoy this magnificent journey you're on, helping to create life and bring it into this world of form. So, thank you, Jacquie. That was really beautiful. Really appreciate you coming on and sharing that.
Thank you, Dale. It's been a joy as always to speak with you, love. Take care. Stay safe.
And you too. Bye.
Thank you so much for listening to the show. If you're interested in learning more about my coaching and mentoring packages, please reach out to me at Adey-Jones@gmail.com. I would love to hear from you.